Good day, Ms. Gan. I am Trikzie Denise Dumagonot, your student nurse from Mate Doctors College, and now I'll be performing the procedure inserting the vaginal suppository. So here's my return demonstration. First, prepare equipment and bring to the bedside. So here are the equipment that I prepared. So organization promotes efficient time management. Second is wash your hands. Hand washing reduces risk of transferring microorganisms. Third, explain the procedure to the patient. An explanation of the procedure discusses the client's anxiety. Ma'am, I am Trikzie Denise, your student nurse, and now I'll be inserting a vaginal suppository. Have the client lie in the dorsal recumbent position. So this position provides easy access to and good exposure of the vaginal canal. Next is, if the client is unable to do peritoneal care by herself, place the client on a bedpan. So next is put on gloves. So the use of gloves prevents transmission of infection between the nurse and the client. So assuming that this is the wet wipe, this is the wet wipe. First, I'll be wiping here inside of the vagina. First, so I fold again. Fold again. So fold according to the desired. So this I'm going to wipe the I'm going to fold the side of the vagina or the external. Next, fold here and the side. So here in the anus. So the last one. Follow procedure in external dash. Dry buttocks with tissue or paper towel. Cleansing the area with soap and water decreases the possibility of introducing microorganisms. So next is remove the fur wrapper with a non-dominant glove hand. Gently expose the vaginal orifice. Retract the labia folds. So insert the rounded end of the suppository. Proper placement of the suppository ensures along the posterior wall of the vaginal canal equal is the distribution of the medication along the length of the index finger, at least to insert the vaginal suppository at least 3 to 4 inches. So withdraw the finger and wipe away any. So this provides for client comfort. So remaining lubricant around the office remaining lubricant from around the orifice and labia. So offer peritoneal pad before the client resumes ambulation. Remove the gloves by pulling them inside and out, placing them in an appropriate receptacle. So removing gloves in this manner prevents and placing them in an appropriate spread of microorganisms. So instruct the client to remain on her back for the position allows medication to melt in at least 10 minutes. Ma'am, how are you? Are you doing good? Can you please at least stay at your position for at least 10 minutes for the medication to be able to um, so that the medication will absorb. So record your observations, treatment given. So a written summary provides an accurate and the response of the client. And that ends my written demonstration of inserting vaginal suppository.